Hello everyone, now let us discuss about 2023 ICD-10 CM coding guidelines for Chapter 21, Part 5. Chapter 21 mainly deals with factors influencing health status and contact with health services. That mainly deals with the Z codes. And in the current session, we will be discussing about the Z codes regarding status. Some of the Z codes regarding the status. Now here is the list of codes that we are going to discuss in the current session. The first one is Z18, which is nothing but retained foreign body fragments. The next is Z19 category, which deals with hormone sensitivity malignancy status. The next is Z21, which deals with asymptomatic HIV infection status. This code is covered in chapter 1. This code indicates that a patient has tested positive for HIV but has manifested no signs or symptoms. That is, patient does not have any signs or symptoms and patient is just HIV positive. In such case, you need to code Z21. The next is Z22, carrier of infectious disease. The carrier status indicates that a person harbors the specific organism of the disease without without manifestation symptoms, and is capable of transmitting the infection. Carrier is nothing but the patient is asymptomatic but he is capable of transmitting the infection. He does not manifest any symptoms but he can transfer the infection or transmit the infection. The next is Z28.3. There are new codes which are given under this session that deals with under immunization status. The next is Z33.1. This is pregnancy state incident. This is also very rarely used. This code is a secondary code only for use when the pregnancy is in no way complicating the reason for visit. Otherwise, a code from obstetric chapter is required. The next is do not resuscitate code, Z66. It deals with do not resuscitate code. This code may be used when it is documented by the provider that a patient is on do not resuscitate status. That is, if something ill happens, any untoward event happens for a patient who is admitted in the inpatient setting, he does not want to be continued on life support. In such case, you need to code Z66 code. It indicates do not resuscitate status at any time during the stay. Now coming to retained foreign body fragments, which are given by the category Z18. Here is the list of complete Z18 codes. The first code is Z18.1. It indicates retained depleted uranium fragments. The next is Z18.09. It deals with other retained radioactive fragments or other retained depleted isotope fragments or retained non-therapeutic radioactive fragments. If the physician documents any of the following, you need to code Z18.09. And all the Z18 category are SDX codes. Z18.10 indicates retained metal fragments unspecified or retained metal fragments NOS. The next is Z18.11. It deals with retained magnetic metal fragments. The next is Z18.12. Retained non-magnetic metal fragments. The next is Z18.2. It deals with retained plastic fragments or acrylic fragments or diethyl hexyl phthalate fragments or isocyanate fragments. In any of the below mentioned terms are indicated, you need to code Z18.2. The next is Z18.31. It deals with retained animal quills or spines. The next is Z18.32. It indicates retained tooth. Next is Z18.33. It indicates retained wood fragments. The next is Z18.39. It indicates other retained organic fragments. The next is Z18.81. Retained glass fragments. The next is Z18.83. Retained stone or crystalline fragments or retained concrete or cement fragments. The next is Z18.89. It deals with other specified retained foreign body fragments. And finally, Z18.9. It deals with retained body fragments, unspecified material. Now coming to next category, that is Z19. Hormone sensitivity malignancy status. There are two codes under this. Z19.1 indicates hormone sensitive malignancy status. That is, that malignancy is sensitive to hormone therapy. The next is Z19.2. It indicates hormone resistant malignancy status, or whenever the physician documents castrate resistant prostate malignancy status, you need to code Z18.2. Let us see an example. A 65-year-old male presents for castrate-resistant prostate cancer. So here the PDX would be C61 to indicate malignancy of prostate. Then Z19.2 to indicate hormone-resistant malignancy status. The next is carrier of infectious disease, which is given by Z22 series. Now here are the list for various Z22 codes. The first one is Z22.0. It indicates carrier of typhoid carrier. The next is Z22.1, carrier of other intestinal infectious diseases. The next is Z22.2, carrier of diphtheria. The next is Z22.31, carrier of bacterial disease due to meningococci. The next is Z22.32, 321, Z22.321, carrier or suspected carrier of methicillin susceptible staphylococcus aureus, MSSA. The next is Z22.322, carrier or suspected carrier of methicillin resistant staphylococcus aureus, or MRSA colonization. The next is Z22.330, carrier of group B streptococcus. The next is Z22.338, carrier of other streptococcus. The next is Z22.39, carrier of other specified bacterial diseases. The next is Z22.4. It deals with carrier of infections with a predominantly sexual mode of transmission. The next is Z22.6. It indicates carrier of human T lymphotropic virus type 1, HTLV1 infection. The next is Z22.7, latent tuberculosis or latent tuberculosis infection, LTBI. The next is Z22.8. It deals with carrier of other infectious diseases. The next is Z22.9, carrier of infectious disease unspecified. These are the various Z22 codes. Now let us see some examples. A 35-year-old patient presents for treatment of latent tuberculosis. The code for tuberculosis and latent tuberculosis is different. So here the code is Z22.7, latent tuberculosis or latent tuberculosis infection. Let us see one more example. A patient is asymptomatic but strep test is positive for streptococcus B. Here patient is asymptomatic but the organism is present. So the patient is considered as a carrier. So the code here is Z22.330, carrier of group B streptococcus. The next thing is immunization not carried out or under immunization status, which is given by category Z28. Here is the list for entire Z28 category. The first code is Z28.21. It deals with immunization not carried out because of acute illness of patient. They mainly deal with the reason why the immunization has not been performed. The next is Z28.02. It deals with immunization not carried out because of chronic illness or condition of patient. The next is Z28.03. It deals with immunization not carried out because of immune compromised state of the patient. The next is Z28.04. It deals with immunization not carried out because of patient's allergy to vaccine or a component of vaccine. The next is Z28.09. It deals with immunization not carried out because of other contraindication. The next is Z28.1. It deals with immunization not carried out because of patient decision for reasons of belief or group pressure, or simply immunization not carried out because of religious belief. The next is Z28.20. It deals with immunization not carried out because of patient decision for unspecified reason. Next is Z28.21. It deals with immunization not carried out because of patient's refusal. The next is Z28.29. It deals with immunization not carried out because of patient's decision to other reasons. Next three are the new codes that have been recently added. Z28.310. It deals with unvaccinated for COVID vaccine. They deal with under immunization status. Z28.310 is indicated for unvaccinated for COVID-19, and Z28.311 is given for partially vaccinated for COVID-19. And next is Z28.39. It deals with other under immunization status. Next is Z28.81. It deals with immunization not carried out because of patient having had the disease. The next is Z28.82. It deals with immunization not carried out because of caregiver or parent or guardian refusal. The next is Z28.83. It deals with immunization not carried out due to unavailability of vaccine. The next is Z28.89. It deals with immunization not carried out for other reason. The next is Z28.9. It deals with immunization not carried out for unspecified reason. Now let us see an example. Patient presents for general annual visit. And here you will see two scenarios. Patient presents for general annual visit if the physician documents unvaccinated for COVID. So here the code is Z28.310, unvaccinated for COVID-19. Second case, patient presents for general annual visit if the physician documents patient is due for the second dose of COVID. The patient is due for the second dose of COVID and the patient is not willing to take the second dose. Here you can quote Z28.311, that is partially vaccinated for COVID-19. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.